Welcome to my channel. This is Bruce the Boss, and today's case is a pandemic in the United Kingdom amongst the vaccinated mostly. Alright, but by the way, if you're not yet subscribed to my channel, go ahead and smash on that subscribe button, like this video, and comment on your video. Those interactions go a long way with helping and allowing me to produce more content, to get the message and the dialogue out there. So please go ahead and subscribe on the channel, like the video, and comment on this video. Now into it. So as I was skimming through the news and seeing what's going on in the world, I just so happened to come across Sky News UK, and they're talking about a rise in cases and enacting Plan B. And I'm like, okay, what's going on in the UK now? What is Boris Johnson and Parliament doing to further restrict people's liberties and rights and freedoms? So if you aren't already aware, what is Plan B and how could it be brought in? All right, so this was a measure that was implemented by the government to do some of the following. So they said, and this was back in September, that Plan B could include some of the following, such as vaccine passports to enter into most indoor settings, as well as a return to mandatory face coverings in certain places, as well as more remote working being required in many places where it is possible. But why would they do this? So I'm looking at the cases and I'm noticing a rise in the cases. There was a big spike back in January, of course, during the winter, but it's since literally collapsed over the course of the year. But then a steady rise once again in July, sharp decline going into August. But since then, it's just been a steady rise, more or less, with some ups and downs, back to some of their record highs that they saw once again back in July, and pretty close, not too far off of what they saw back in the winter of January. So they're seeing a steady increase in cases, a sharp increase actually, despite the fact, and here's the big kicker, if you weren't already aware of what their vaccination rates were, amongst in the United Kingdom, you have a total of 49.7 million people with at least one dose. 45.6 million people with their second dose, therefore making them fully vaccinated. And then another 6.7 million who've had their booster shot and, or as you can call it, their third dose. Bringing the total population of those over the age of 12, a total whopping of 86.6% of the total population over the age of 12, so teenagers on up, with at least one dose. 79.3% of those who have been fully vaccinated, so darn near 80% fully vaccinated, with a total of about 11.7 who have gone on and gotten the third dose and or booster shot. That's far past the herd immunity numbers we were told we needed for, at the very least, not including natural immunity, those who got some level of immunity through vaccination, well past the goalposts, much farther than where we are in the United States. 86.6% with at least one dose, 79.3% with both doses, practically fully vaccinated. And yet, you're seeing cases on the rise. Why is that? How is it that we're still seeing a record number of cases despite the fact that you're seeing a record number of those who were vaccinated? So we were told that get the jab and you can end this pandemic for good. You can end it. And you're protecting your grandmother, protecting the people around you. And yet, amongst a practically fully vaccinated population there in the United Kingdom, 86% with just one, practically 80%, 79.89% fully double jab, and you're still seeing record cases, a case number that is reaching near record highs that you haven't seen since the winter and or early parts of the summer, meaning you're having a pandemic amongst the vaccinated. And if what Charles Barkley said was true, oh, you do this to protect other people, the people around you, you do this for others, why are we seeing these record number of cases if it truly does stop you from giving it to other people? We're seeing the revert In fact, let's not forget, during the course of the summer, the CDC even leaked out data that was coming in from all over the world showing that the viral load in those who were fully jabbed was exactly the same as those who were not jabbed. So then the question then becomes, well, you're helping the healthcare system, you're avoiding being hospitalization, and at least death is down, so you're not dying, as if death was a likelihood in something that had a 99.997% survival rate, or for those under the age of 50, and even those in their 50s, a 99.97% a 99.94% survival rate, somewhere around that ballpark, still over 99.5%. But then let's take a look at who's really being hospitalized. Are all those who get infected end up with the same outcomes of hospitalizations? Let's take a look at what the CDC says on that. Now, I'm about to mix a little bit of American medical research in here with the United Kingdom just to make a point. So this is from the CDC's own website and a study that they've done, probably the most conclusive and a research study that they had with the most amount of data. This is going from March of 2020 to March of 2021. So here are the results. So out of 4,899,447 hospitalized patients, the median age, mind you, was 66. Anyone who knows a little bit of math, in order to get a median age of 66, you're not talking about a hell of a lot of people in their 20s or 30s or teens for that matter. Not in the least. You're talking about mostly people in their 60s, 70s, 80s, and those in their 50s to bring the number down a little bit. So now let's look at the underlying condition. Keep in mind, they, by their own admission, state that over 94% of those who were in the hospital, so let's see here, 94.9% had at least one of the documented underlying conditions. So let's take a look. Hypertension was by far the majority of those in the hospital or hospitalized with COVID were those who suffer from hypertension, which, last I recall, mostly occurred in those who may have struggles with their weight and or obesity. Disorders of lipid metabolism, sounds like also related. Obesity in and of itself, the next most leading cause of hospitalizations. Diabetes, or those who had complications with diabetes. Oh my! Looks like it's related to weight as well. Coronary heart disease, chronic kidney disorder, anxiety and fear-related disorders. Fear being a cause of hospitalizations. Oh my, you wonder if they're doing nothing but fear porn all day, every day on the news and doing nothing but showing upticks in number of total cases and or death day after day, night after night. COPD and bronchitis, thyroid disorder. So my thing is, if you do not check off any of those boxes of pre-existing conditions and or age range of being elderly, then why are they pushing these mandates for vaccine passports? Why are they pushing these mandates for you to do this in order to live a normal life, when the fact of the matter is the UK is rapidly approaching 90% fully jabbed and still seeing a surge in cases and talking about PlanB? Why are they mandating this when it doesn't seem to really be having the effect on cases that you thought it would? Why are your jobs at risk? Why are you giving up your liberties and your freedoms? Freedom of association, freedom of medical decision and bodily autonomy. Why? It seems as though you were fed a lie as it pertains to what getting jabbed was going to initially do. Why are you still doing this? At what point do you push back and say no more? And or what's really in it for the big pharma individuals to keep pushing this despite the fact that you're not seeing it really curve the cases at all? That's my point, and that's what I think you should really take into consideration before you hear things like, oh, you need to get this in order to avoid an outbreak, despite the fact that we're still seeing outbreaks amongst these fully jabbed populations. And we need to fight back against the argument, well, you do it to protect other people, to reduce your chances. I'm not seeing that reduced chance and or reduced transmission in the UK whatsoever. You tell me. Again, we are seeing fewer deaths, but again, this is something that, unless if you have one of those pre-existing conditions that we talked about or shown in the CDC chart, you were really never in that much danger to begin with. Again, I go back to 99.97 or 99.997% survival rate pre-vaccine. Hospitalization, 95% were either of elderly age and or had one of those existing conditions. And if you can take care of those conditions as an individual who's still relatively young, take care of your health, then you significantly reduce your risk. And there is such a thing called natural immunity. But that's my video, despite what they try to talk about, what's the word I'm looking for? Breakthrough cases, which doesn't seem to actually be a true term in all. It seems to be more so a misnomer, a falsehood, a lie. But that's the video. I want to know what you think. Let me know what you think in the comment section. Like this video, comment on this video, share this video, and don't forget to subscribe to my channel, as well as ring that little notification bell. We need to beat the myth that they're trying to push out there, or the falsehood that they're trying to use to compel individuals into compliance or submission. This is Bruce the Boss, and I'm out. Peace.